All right, good day, everyone, and welcome to our continuing series is talking on Facebook Live with the leaders from Westchester County as we're working through the coronavirus COVID-19 scenario. We're not counting days. We've been doing this since March 3rd, and this is an important service, and we're glad that you all are paying attention and listening to us here on Facebook Live or taking a little later on westchestergov.com's Facebook page. Today, we're really pleased as Punch to have one of our health leaders here in Westchester County, a leader that has been doing such tremendous work with us, a partner for many years, but now Westchester Medical Center Health Network, WMC Health Chief Medical Director, Dr. Renee Garrick is with us today. Dr. Garrick, thank you for joining us and being able to talk a little bit about the great work that's been done with WMC Health. You all have been partners with us, our Department of Health, Commissioner Shirlita Amler and the team from day one, right? We have a hospital network that is not quite the size of New York City. It's not even close to being the same size. So all of the partners out there know each other. And again, WMC Health doing the great work that they're doing, having the testing units set up, the second drive-through testing site. The first one was the one that the state set up on county property at Glen Island. But the first one at a medical facility belonged to WMC Health. And again, Dr. Garrick, thank you for being with us today.
Thanks, Ken. It's really a pleasure to be here. And, just to follow up on a couple of comments you made, I wanted to really acknowledge the amazing work that started very early on with the Commissioner of Health, with Shirlita. We've partnered from the very beginning. And actually people don't know this, but the hospital and Shirlita teamed up to do COVID studies on patients that were brought up from New York City. And we were actually doing swabs and having them sent up to Wadsworth or down to the CDC in the early days of March and in late February. So
late February.
Yep. And it was done very carefully. It was done with great care. And we did it in ways that didn't attract a lot of attention because it was very early on in the COVID, what's now the clear pandemic. And the Department of Health and the Commissioner have been just stellar partners. If you think about it, when a patient was first diagnosed with COVID in the hospital, we had to find ways to have them go home. And when they had to go home, we had to make sure that their families were protected. So one of the things that Shirlita's group would do would be to go into the home to make sure that there was the right environment. The rest of the family was safe because we wanted to do everything we could to prevent spread. And that was done with the utmost of care for the patient's families so that we could do social distancing and prevent the spread. And that's really, Westchester really should be very proud of what it accomplished, because if you think about it, in terms of COVID confirmed cases, we've had in Westchester County over 30,000 confirmed cases of COVID. And we have we rival New York City and Manhattan in terms of those numbers. And you can see that they had the potential to put a real stress on healthcare and on homes and environments. And people did an excellent job in terms of maintaining the health of the Westchester population.
Well, Dr. Garrick, one of the things, again, and that's so critically important, as you said, most people recognize from when we had the first Westchester-based case and our index patient in Westchester, did not even realize that the work that was being done with partners like WMC Health and our county health department in trying to ensure that patient that came from New York, actually from Wuhan province, that had visited in there and came back to New York City in the hospital system. And then we needed to help isolate them at home. And you all, as WMC Health, were partners in making sure that we did the testing and identifying the right things to do in the way that we should do with privacy and patient care, and trying to do things. And that area at the time was containment, not at the pandemic levels that we are now. So, can you talk a little bit about that? Because, I think there's a lot of confusion out there about, going to the hospital now and making sure that people are not taking care of themselves. They're like, oh, I got to stay away from a hospital because, there's COVID patients there and we need to call ahead and don't just just don't show up at the emergency room door, etc. Hey, there's people out there that have serious issues that they need hospital care, and they should not be afraid at all to go to any hospitals, especially at their brand new wing at WMC.
Right. Thanks. No, you know what, Ken, that is so important now. And you're absolutely right. Remember in the early phases before we had our real surge, there were messages that were carefully shared with families and with the population of Westchester that, don't rush to the hospital if you have a cough or a sore throat. That has changed completely. We are over that hurdle. And we want patients to understand that if you have a medical problem, if you have chest pain or you're short of breath or you have the need to come to a hospital, it is absolutely safe. It is absolutely fine. And we don't want someone to stay at home thinking that it's not safe to get care, because that is absolutely not correct. The environment is safe and sound and protected. And in fact, it always has been. We were, like many other hospitals, very, very organized in having areas of the hospital that were used to cohort patients with COVID. And it was almost as if we were running two hospitals. But certainly, we definitely need the public to understand that if you need care, do not stay at home. Come to the hospital and get care. And you might have seen the studies that are already coming out about patients with heart disease that have waited and not gotten into a hospital. We want people to understand it is safe. We are here, the doors are open, and we are ready to provide all the kind of care that you need. And we really need the public to know that.
And again, so let's echo it again, Dr. Garrick, because again, it can't be said that many more times. It can't help reinforce. If you need help, that's hospital level help that you would have gone to emergency room before, you should still go to an emergency room and you should get that care that you need. And certainly there's some elective surgeries that the governor has stopped at this point in time, but there's still a lot of other things that are happening. And again, people need to understand WMC has done a great job cohorting, isolating people. Hospitals have a lot of stuff going on in it. And this is just another thing, but certainly WMC Health is up to that challenge.
Yeah, absolutely. Thanks, Ken. And the cath labs are running. We can do heart surgery. If you need emergency surgery, if you have a trauma, that has never stopped and it will never stop here. And we don't want people to be frightened. We want people to understand that you have hospitals like Westchester Medical Center that are here to provide that care 24/7. And in fact, the interesting thing is, as we typically get about one patient every hour, every day, all year long that comes in transfer from other hospitals. So we get over 9,000 transfers a day from the Hudson Valley region into our hospital. And as you might, appreciate, that slowed down considerably in the peak of the COVID pandemic in this region. That has picked back up. We're very thankful for that, because it means the patients in the Hudson Valley region are now again able to be transported and transferred for the kind of care and the higher level of care that they need. And we want to make sure that people understand that. So the transfer centers there, the helicopters are running, and you are absolutely right. We want people to be able to get the care they need. And the hospital is well equipped for that. We have plenty of capacity.
Well, thank you. And again, not only just the capacity, but the expertise and professionalism of all of the team at WMC Health. So let's take a few seconds to talk about it, because there's some exciting things that just started happening this week on May 4th. And for all of us, where we almost lost 2 months of time, we turned around, it's May and already. And for those folks, we're getting ready to make sure that we recognize all our moms out there on Mother's Day in a new socially distant and a fancy way doing that. But for you all, that you started the antibody testing. Can you talk a little bit about that? Because there's people that are just so completely confused about, diagnostic testing, which you all did a tremendous job. Tell us about those statistics. But in addition to that, talk about that exciting thing that's happening in the county center, transferred medical center, WMC Health Extension for the antibody testing.
You bet. So let's talk about both ends. And so let's talk about diagnostic testing first. So obviously, to know what to do, you have to know who has COVID. So testing is absolutely critical. And early on, maybe by the second week of March, we had the testing center tent was up and running. That was helped by the county police and by the county. And in that center, we had 4 drive-through lanes, and we're able to do a swab through the nose that could test for tiny fragments of the virus. So it's a very sensitive study. And it's astonishing. We've done over 28,000 tests of swabs through those drive-through things. And if you think about it, Ken, countywide, there have been about 100,000 tests done, and around 28,000 of them are done at the medical center.
Wow, that's fantastic.
So it's really has been a great team effort. And that allowed us to know early on who had an illness. In the hospital, we actually were able to do the 2-hour test. So we really knew. And so early on in this, by the 3rd week, we were testing every single patient that came into the hospital to see if they had COVID. And that was very important because then we knew, were you positive? And as you know, we learned that it's possible to have COVID and not have symptoms. Absolutely. That's now led us to the antibody testing. So there are people that had COVID that actually don't know they had COVID because they didn't have symptoms. And the way you determine that is actually by looking for antibodies, because after you've had an illness, you mount an immune response and you get antibodies. So now what we're doing is drawing a tube of blood. And in that tube of blood, we actually look inside the blood and look for antibodies. And the one we're looking for is the antibody that comes in the 2nd phase of recovery. And we're now doing antibody testing for all of our staff and for the first responders. And the first responders are coming through the county center, as you mentioned, and we're doing a blood draw and we're testing them for antibodies. So we've already done about 3,200 antibody tests.
Wow.
Yeah, so we started them last week. So we started last Thursday, I think. And we started them on our staff. And I think our staff, we've had, I don't know, close to 1,900 tests done already. And network-wide, we've done about, like I said, about over 3,000. And it's wonderful because now it lets us have a better idea of who's had the disease. And you mentioned about antibody testing, and the media has raised a lot of confusion, a lot of concern. And that's true because a lot of tests got approved and some are better than others. And the one that we're using is a true blood draw. So we are actually looking in the blood, not at a little finger prick, not at a spot. You know, there are a lot of ones out there. And ours is a highly sensitive and specific test in the 99 to 100% range because we want to make sure that we're identifying patients who really had COVID. And
when you have this, talk for a second about how quick the test is, because I know that we started seeing the test started on Monday. First, this thing really came together very, very quickly.
Yeah.
And for
good
people
partnership.
to understand how quickly that partnership came about, and it is because of our long-term relationship with each other between the Westchester Medical Center, WMCHealth, and Westchester County. Right. But also, we have a bunch of old friends that are running that effort at the state level. Certainly a Westchester resident, Larry Schwartz, is part of that right. whole operation and doing that. And that's,
we wanted to serve the first responders. Right? I mean, they are spectacular individuals on the front line, and anything we can do to help the first responders, we will always be there. So having, getting the antibody test just said somewhere along the line, you had COVID, you had COVID and your body fought it off. And it doesn't right. say what level that was. Obviously, it wasn't one that you ended up in the hospital for, or you would have known, right? But you ran into the COVID virus, your body developed the antibodies. And what does that mean for people? Because, I've seen some people turn around and they go, oh my gosh, you had that, and now we need to quarantine everyone in your family, et cetera. Right. Yeah, a lot of confusion, right? So the antibody test doesn't mean anything about needing to quarantine you. It doesn't mean it means that at some point you were exposed to the virus and you defended yourself by making antibodies, and now you move on. What we don't know yet about this antibody is whether the immunity that it provides will be lifelong. And, for some diseases, you remember that when we were kids, we had the measles maybe.
Yep.
And that's lifelong immunity. That lasts a long time. Other immunities like chickenpox, we think might fade. And that's why now, as we get older, people are advising us to get a chickenpox, a varicella booster. Because sometimes, right, exactly. Because sometimes, that fades over time. We don't know yet. This is a brand new disease. We don't know yet. Will this be a lasting immunity? Will it be a month? Will it be a year? We don't know. So there's so much about this disease that we still need to learn. That we are not doing in the hospital, we're not doing anything different. If you're antibody positive, it doesn't change your protective equipment. It doesn't change your work assignment. It changes nothing. It just means, oh, interesting, you had COVID. So people need to understand that. It doesn't mean you're quarantined. It certainly doesn't change your work assignment. It doesn't mean anything. It's a very important public health question. And then we'll learn more as we keep learning. And that's been one of our big goals here. Is, I think, we've talked before, we've done a lot of, been engaged in a lot of research at the medical center about COVID. We were one of the first trials with Regeneron to look at this compound that's an IL-6 receptor blocker. There's something about this disease, this virus, that overactivates the immune system. And all the things called cytokines in the blood get stirred up. And this test that we're doing with Regeneron blocks one of those cytokines to tamp down this response, to keep people from getting this so-called cytokine surge and getting so very, very ill from the virus. And our hospital was engaged in the very first phase of the Regeneron trial for IL-6. And I'm really proud to tell you that we have given over 200 units of convalescent plasma. I think we're one of the largest in the country. We teamed up with the New York Blood Center and with a lot of community groups that helped have people who had COVID and had recovered from COVID donate their plasma. And that's called convalescent plasma. And that plasma now has special antibodies in it. So the theory is if we give that plasma to patients who are now ill with COVID, that those antibodies that we give them may help them fight the disease. And the FDA put together a study with Mayo Clinic out west as one of the leads, and we became one of the early participants in that trial. And teaming up with some of the community groups, largely from Rockland and the communities out in Long Island, the community activist groups were able to put together a donation groups and donated large amounts of plasma. So we have now given this convalescent plasma to every patient here who is eligible who had COVID. And we're continuing to do that.
And again, people don't recognize the WMC Health, the Westchester Medical Center Health Network, Westchester Medical Center itself. They really should understand the kind of leader that WMC Health is. As you said, the tertiary care where other hospitals feed into you, but also with your next door neighbor partner, Regeneron, teaming up with everyone. I mean, if people see hospitals now, and I know that's going to be a conversation for another day at a much higher level beyond all of our pay grades, to talk about how this particular pandemic showed some of the gaps of coverage that we had, that we were going a specific direction when we were doing all these big networks and getting local facilities and that kind of thing. And now that there needs to be some rethinking. Exactly what does that mean? I'm not sure it's exactly what it was, but it definitely needs to make some changes.
So, I'd love to talk about that for a second. So our network is, it's here, Good Samaritan, which is a charity hospital, which is a 3-hospital system in Rockland, and it's affiliated nursing homes and extended care facilities, Mid-Hudson Regional, and then the hospitals up in the Health Alliance system. So we span 1,700 beds and span the entire Hudson Valley. And the reason, Ken, why that is so critical is early on in this pandemic, we developed a system around our network to share things. So we shared ventilators, we shared PPE, we shared staff. We have, obviously we're a high-end academic medical center. So we have our high-end anesthesiologists were able to go to Good Sam to help some of those patients. We had our medical staff with our residents and fellows able to man some of the ICUs here. So you are really so, your comment is so important about the ability for networks to help each other. So within our network, we made sure that all of the hospitals in the Westchester Health Network had frontline staff available, had all the equipment and all the supplies. And just to let people know how amazing the state has been. The state of New York was in contact with the hospitals very early on. They helped to make sure that we had the PPE that was needed, and that we had ventilators that were required, and that we had dialysis fluid for patients. They have been a spectacular partner. And they really need a huge amount of thanks for that, because they really took every kind of action that they could to make sure that the healthcare of the state was supported.
Well, something, and again, Dr. Garrick, we want to make sure, again, to give a special shout out for WMC Health, you and your team and all of the professionals that are there that have been doing things. I really want to end on something that's so positive. Talk about the people that have recovered, that are leaving the hospital after successfully getting through this particular thing. Yeah. And certainly, it's a proud moment for all of the work that's been done, and the work that we still continue to do.
Yeah, it has been. So we've had, if you look at all the patients with COVID suspected and all the patients with known COVID, we've had well over 3,000 to 4,000 patients with COVID treated in our hospital system of COVID and COVID rule out. And we're just today probably going to hit our 1,000th discharge for confirmed COVID patients. We have a clap out when patients leave. It is so heartwarming to the staff, because this is why people go into healthcare, is to be able to provide care when it's really needed and to provide very high-end, compassionate care for patients in a time of great need. One of the things you might have seen is a lot of data that came out of last week about patients who required ventilators. And our data on patients who've required intubation and ventilation, we now have many of those patients who have been through the ICU and have been discharged home.
All right.
So our survival rate on intubated, ventilated patients is far better. In fact, we're much better than what you've been seeing elsewhere. We're well over a 25% survival rate. This is already home now. And we have many, many more patients that are still in the hospital who will be leaving. So we don't want people to be misled. There's a lot more to learn about COVID. We are so proud of the fact that probably today we'll hit our 1,000th discharge of patients from our network home, awesome, recovered, back with their families. And that's a lot to be proud of. It's a very high recovery rate overall. We're well into the 80% recovery rate, much greater than what you might see it from some other areas of the country. So a lot of good work.
One, first, congratulations on reaching that milestone. It's our hard work that everyone has put in together.
Great work by the frontline staff. I'll say the nursing
staff. And I know it's National Nurses Appreciation Day. With shout out to the nurses. My mom was
today, right?
It's today starts
nursing week. We could not be. Thanks, Ken. We could not be prouder of our staff. There is not one person in this facility that did not step up and help. 100% across the board. It is just a spectacular place to work, great staff, and we love giving great care to the community.
Well, Dr. Garrick, well, thank you for taking some time out, and again, for Westchester WMC Health, the Westchester Medical Center Health Network, all of your partners and everything together, continue, to be safe and continue support for all of your members and staff and folks that make everything happen on that front line there. And we really appreciate the partnership with you at the county center with the antibody testing. That's for our first responders and other folks that are essential workers that are out there, because it is including not just the frontline workers or first responders, but it also is being expanded to make sure it includes our essential workers that are out there making sure that when we go to the grocery store, there's food up on the shelf, et cetera. And all of those folks are important. Thank you for everything you're doing. Dr. Renee Garrick, WMC Chief Medical Person over there. Thank you so much, our medical chief. Dr. Garrick, have a wonderful day. And again, stay safe.
Great. You too, Ken. Thanks so much. It was a pleasure chatting. Take care.